Hello, good afternoon. My name is Andy McGill, Head Vitality Coach, and you're very welcome to our webinar this afternoon on breathing for good health. It's my total pleasure to introduce and be joined by Head of Engagement and physiotherapist Jane Stokes from Vitality partner mhealth. Good afternoon, Jane.
Hi, Andy. Lovely to be here. Thank you.
Yeah, it's great to have you here. Jane, we've got a lot to get through today, and the discussion is really exciting. We'll get going in just a second, but before we do, for everyone who is with us this afternoon, firstly, thank you so much for taking time out of your day to join us. It's our pleasure to have you here. Secondly, just a little bit of housekeeping. On the right-hand side of your screen, you should see a box which has got a few different panels in it. I want to direct your attention to two things. First and foremost, we have our handout section. So our handout section has the details of all of the events that we will be hosting over the course of March. This is the very first one of 6, so please do download that. Please do stay tuned and tune in for those events that take your fancy and you'd like to join us for. And then in addition to that, share far and wide as well. Everyone is very welcome, and we hope that you do enjoy them. Secondly, we've got our Q&A box as well. So today's webinar is very much for you. And today we're honoured to be joined by Jane, who's a subject matter expert who's a physiotherapist and a subject matter expert in breathing. So if you have any questions as we go through today's content, please pop them in the Q&A box, and we'll do our very best to answer those questions for you. We also have some pre-submitted questions in advance, so again, we'll weave those through as we go on. Without much further ado, Jane, do you want to just give us a little bit of an introduction and a little bit of background as to what brings you here today?
Yeah, no, absolutely. So again, thanks for having me on today. It's great to come and speak to everyone about breathing, breathlessness, and all things related. So my background is I'm a senior respiratory specialist physiotherapist and also an advanced critical care practitioner. I've been working in respiratory specialist sort of physiotherapy area of work since 2007. And as well as working in the NHS, I now work for mhealth. And they, as you just mentioned, are a partner of Vitality, but also we develop apps for patients with long-term conditions to help to support their day-to-day management, and also the healthcare teams who manage them, their care around their day-to-day functioning as well. So the reason I'm here today, though, is in the capacity as a respiratory specialist physio, just to maybe share some insights and hints and tips on how to manage breathlessness.
That's absolutely brilliant, Jane. And I know in our prep for this webinar, even full disclosure, prior to working for Vitality, I was a physiotherapist for almost 10 years as well. So it's been nice to blow the dust off the grey matter and chat about a few of these technical aspects, but really looking forward to the content, and there's lots to be involved with. So yet again, everyone, please do pop your questions in, and we'll do our very best to answer those as we go through. So Jane, let's get back to basics. Let's start with the most pressing question. What is breathing?
So breathing in its purest form is simply the movement of air from outside of our bodies, from the atmosphere around us, into our lungs, and then back out again. Our bodies do some amazing things with that air once it gets into our lungs, but breathing itself is purely that movement of air outside to in, inside to out. That's it. Really simple.
So using that as our basis, again, air in, air out, and there's lots of very clever things that happen in the meantime. What is the purpose? Why do we breathe?
So in terms of why we breathe, well, there's two main gases that stimulate us to breathe, and they are carbon dioxide and oxygen. Now, the cells of our bodies, they need oxygen for energy to be able to function properly, and the air we breathe in from the atmosphere contains around 21% oxygen, and that's inhaled into the lungs. It then diffuses into the bloodstream, and it's transported around the body to the cells of every organ and every tissue. And as your cells use that oxygen to create energy, that creates a waste product, which is called carbon dioxide. That then passes back into the bloodstream, transports to the lungs, and again, we breathe that out. So breathing is usually automatic, and it's controlled by centers that sit at the base of our brain, and they will pick up on the levels of oxygen and carbon dioxide in our bloodstream at any one time. And that will either cause us to breathe faster and harder, or slow down our breathing as well. So it's automatically controlled and regulated. We don't have to sit here and think, breathe in, breathe out, breathe in, breathe out every minute of every day. That should happen automatically in a normal function. And like I say, it's there primarily to get oxygen in so we can create energy in the cells of our body, and then to get rid of the waste product, which is carbon dioxide.
So Jane, there's kind of almost, without us knowing it, it is a good job that we don't have to think about breathing in and breathing out, because we've got a lot of other things to juggle on a day-to-day basis. There's almost like a control center there that is monitoring blood level, blood oxygen levels, blood carbon dioxide levels, and then pushing, sort of working to make us breathe faster, slower, deeper, shallower, all of these different things. Now, what does normal look like? Like, what should this be, or what would you expect in sort of if we take our attendees today, someone sitting at home or sitting in the office on a normal work day, or someone who's otherwise quite healthy? What would be our starting point? What is normal?
Yeah, so normal is our body working to keep that balance, so the right balance of oxygen and carbon dioxide circulating through our bodies at any one time. Now, at rest, the normal rate of breathing to maintain that normal is between 12 and 20 breaths per minute. Now, this is not deep breathing, it's nice, easy breathing, sat at rest, in and out, between 12 and 20 times a minute. That is normal. It's also normal that if I were to walk up a flight of stairs or go for a run, so I'm increasing the demand on my body for energy, that I would breathe harder and faster, that I'm going to get more breathless. So breathlessness is a normal response to increased demand of our body. And it's a good response as well. It's a positive sign. And getting breathless and being out of breath is actually part of keeping our bodies fit and strong. Now, it's recommended that we should be aiming to achieve around about 150 minutes per week of moderate intensity of activity to help keep us fit and strong, or 75 minutes of high intensity exercise. So if we focus on moderate intensity activity, what does that actually mean? That means doing enough activity to get your heart beating faster, your lungs working harder, so you're breathing harder, faster, so more breathless. But you should still be able to speak in short sentences. So a really good thing that I use with people that I'm working with is to say, can you say this sentence? So if I was to say now, this exercise is doing me good, you can see I've said that whole sentence without a break, without any breathlessness. I'm not working hard enough. But if I was to be working hard and I was to say this exercise is doing me good, so I'm having to break that sentence up, that is an appropriate level of breathlessness for a moderate intensity activity. If I start to get to the point where I'm going, this exercise is doing me good, I'm probably pushing past the moderate zone into a higher level of intensity. So we need to maybe reduce the intensity of the activity or have a rest and try and get back in control of our breathing. That 150 minutes per week target as well should actually say can be split into sections across the week. We don't expect someone to go and do 150 minutes one day a week, done, job done for the week. It's about having regular activity across the week. So it may well be that you do 30 minutes of exercise 5 times a week, or you may well do 15 minutes of exercise in the morning, 15 minutes of exercise in the afternoon, 5 times a week. That would all count up to a total of 150 minutes in a week. Now, also, if you're relatively new to exercise, it is wise to start with, smaller bouts of activity and build up. So it is recommended you need 10 minutes at least of activity, moderate intensity activity to get the benefit. So start off with 10 minutes, build up slowly, and try to work towards getting that 150 minutes per week.
That's just a really, really key message that we're hearing from you there, Jane, is around breathlessness. And that breathlessness is so we're talking about the average person here who's of average health and otherwise no other conditions. Breathlessness is something that we should get comfortable with, or understand that that's part of a normal physiological response to increase in demand on the body. So let's just maybe in a practical sense, with regards to if we're achieving our exercise minutes on an easier side with the 150 minutes, or more intense on the 75, just for everyone's benefit at home, what would that actually look like? So what would I want exercising at 100 in terms of leisurely at 150 minutes? What level of breathlessness, if we can just revisit that, should that be? And if I was doing it at a little bit of a higher intensity, what should that be? Because what we're talking about here is essentially allowing ourselves to get breathless, but at the same time, given a little bit of control, and so that we know, okay, no, I'm too breathless, I need to cut it back, or alternatively, maybe I'm not breathless enough, maybe I could push this exercise a little bit more. So if we can just revisit those 2 examples, that would be fantastic.
Yeah, no, absolutely. So moderate level of intensity should be where you're feeling more breathless, you can feel that your heart rate has increased, And you can speak short sentences, but not a full complete sentence. So I might be breathless after every couple words and have to stop and take a breath, but I could still speak in short sections, so 2 or 3 words together. So this exercise is doing me good. That's moderate level of intensity. If, however, I'm at the point where I have to stop after every word to take a breath, so this exercise is doing, that's more higher intensity activity, and it may well be that you get to the state where you can't breathe. You can't speak, sorry. So you can't actually speak because you're working too hard, you're breathing too hard. And that's not to say that that's negative. High performance athletes, we quite often see them in that state post exercise or during exercise. But I think for most people, if we aim to achieve the moderate intensity activity, that's a good place to start from. And that's exercises that might lead to moderate intensity activity or aligned to it would be things like going for a brisk walk, jogging, maybe doing gardening, even housework, as long as it's getting your heart rate up, making you breathe harder and faster as well.
Really good, Jane. So again, but we're also saying is you don't need to be like those athletes that collapse whenever they cross the finish line to get fitter. It can be very simple things. We've even had a comment about someone who's dashing between platforms at Bristol Temple Meads and trying to catch their breath, but also yet restrict their breathing because of their mask and everything, which is quite a unique scenario. Jane, there's the action of breathing. What actually helps us with breathing? We've got a system of muscles and ribs and intercostal muscles. Can you tell us a little bit about that? Because I think that will also provide some context as to how, dare I say, we can be relatively unpracticed at breathing effectively and how we can then get better at that.
Yeah, no, absolutely. So let's take it right back to the muscles that help us to breathe. I mean, we probably know some of the main structures involved in breathing, so our lungs, our rib cage, our nose, back of our throat, the airways, etc. But think about the muscles. The muscles are really, really important. And the 2 main muscles involved in breathing are the diaphragm, which is a big sort of dome-shaped muscle that sits underneath your lungs, inside your rib cage, and your intercostal muscles. So these are small muscles which are in between your ribs. So they are the 2 main muscles of breathing. They're extremely efficient, so they don't fatigue the way other muscles might do if they were to be regularly involved every single minute of every day in an activity. They are extremely well trained to be able to maintain normal breathing and also to increase to the demands of maybe exercise exertion. There are other muscles that can get involved in breathing. So if you breathe very hard, you may well see that people have got their shoulders hunched up, their necks tight, the top of their chest is heaving as well. So the muscles around the shoulder, the neck and the chest can become involved. These are sometimes what we call accessory muscles. They're not the normal muscles of breathing, but they can be used if we really need to work hard in our breathing. However, they're not as efficient as the diaphragm and intercostals, and they themselves can fatigue and demand more oxygen and, put increase in the work of breathing themselves. And also, if you see someone breathing from the top of the chest like this and really fixing hard, they're not really getting much air down to the bottom of their lungs. It's not effective, efficient breathing. So for short, sharp periods of time, okay. For a long period of times, we don't want to be using these muscles. They're not going to help us. So we've got to do a few things to try and reduce the reliance on those muscles and make sure that we're using the correct muscles for breathing. And some really good techniques to help support us when we're breathless are called positions of ease. Now, these are positions designed to support us and to reduce our work of breathing, whilst we might do other breathing exercises and techniques to try and get back in control. Now, you can do these in standing, you can do them in sitting, and you can do them in lying. But if I show you some now, that might be quite useful. So, for example, I don't know if you can see here, I'm just going to scoot this down a little bit. If I'm leaning on a desk, as I've got here, hopefully you can see that. If I'm feeling quite short of breath, I would take the work of breathing out of my upper body by leaning forward. So I've got support across my shoulders, my top of my chest, my neck's relaxed, but then I can just focus on doing whatever breathing exercises I need to do to regain control. But I'm taking my arms out. I'm not fixing, I'm not tight, I'm nice and relaxed in that forward leaning position. That position can also be used when you're in standing. So it may well be that a chair like I've got behind me now, nice and stable and quite tall, I could lean forward on that, again, to take the work out of my upper body whilst I regaining control of my breathing. If you haven't got something to lean against, but you maybe have a wall, you could lean against the wall. You can do that leaning to the side, or you can alternatively lean backwards against the wall, as long as you're nice and stable, supported position. But in that position again, make sure that you're not fixing with your arms. Your arms should be hung and relaxed at your sides whilst you're in those positions. And then finally, if you're finding that you get breathless when you're lying down, and you want a position that helps with breathlessness in lying, then the recommendation is that you would go for half lying. So what that means is that you would prop your upper body up, and this is not just from your shoulders upwards, it's from the bottom of your rib cage up. So either a number of pillows or a wedge to prop you up in half lying is what we call it. And then also maybe adding, either lying on your left or right hand side can help with your breathing as well.
Amazing. And Jane, we might find that, I suppose, for anyone that is watching, you might find that we find these positions naturally ourselves anyways, whenever we're breathless. Like you see, if you have been exercising, you might bend over with your hands on your knees, things like that. So we'll be so for everyone, our challenge to you is look at the things that you're already doing, and then, Jane, I think what the key thing that you're telling us there is maybe find those positions, but it's about relaxing. It's about switching off the big muscles that essentially are the accessory muscles that are the last bit of help that the body can extract. But at the same time, we just need to almost get that tummy breathing back, get the deep breaths going in. And we've had a lot of questions with regards to, for example, one question asking, why do some people naturally have large deep breaths and other people maybe have shallower shorter breaths? And I think the point that you've made really is around our intercostals and diaphragm are designed to work very low level over the course of, well, all the time, 24 hours a day, 7 days a week. So that's why that's very much the sort of the calm, relaxed breathing. It's whenever we're putting more, exerting more, demanding more of our body, that's whenever the breathing pattern changes and we'll be taking different types of breath and actually using more accessory muscles. I suppose, Jane, can you, with regards to, I suppose, going back to what our webinar is about in terms of breathing, I think what you've shared us so far is absolutely fantastic. What are the benefits of having good breathing technique? Why should we be considering this?
So there's a number of benefits for whether you're chronically breathless or you're just experiencing breathless day to day in response to exertion, or you're a high performance athlete. There's a number of reasons why, actually working to manage control of your breathlessness are really important, so that doesn't negatively affect you further down the line. But also that in terms of athletic performance, even if you're the most high performance athlete, you can still get benefits in your physical performance by doing focused work on your breathing. It's just the same as singers. They do exercise to train their breathing patterns, strengthen their muscles to support their voice and control. So the same applies for everyone else in day-to-day activities and the high performance athletes as well. And there's a couple of key things which you can do to support athletic performance particularly, but they are just as applicable if you're experiencing breathless day to day. And if it's all right, we'll go through a few of those. Is that okay?
Absolutely, Jane. I'll demonstrate as best I can under your expert instruction.
Lovely. So the first one is think about how we're getting that air in. So the first one is, are you breathing through your nose or are you breathing through your mouth? Now, a lot of us will resort to mouth breathing, especially when we're out and we're doing an activity. You might feel more out of puff, and being out of puff itself kind of has an implication that we're puffing in and out through our mouth. Now, there is also a school of thought that the nose is for breathing and the mouth is for eating, and for good reason, because the nose is actually far more efficient at doing a number of things with the air that we breathe in as opposed to mouth breathing. So first of all, the nose can warm the air, it can also filter the air, and it can moisten the air, so it humidifies the air that we're breathing in. It's our natural humidification system. So if we're breathing through our mouth, you quite often, if you're breathing and panting through your mouth, you'll find that you're getting very dry, and also the air that you're breathing in is very dry, and it hasn't necessarily gone through the same filtration process, and it's not as warm either. So if you can, breathing in through your nose is a very effective technique to support just good inhalation, good taking in of the air as well. Now, from an athletic performance point of view as well, breathing through your nose has been shown to actually slow down our breathing as well, even when you're working quite hard. And through slowing your breathing down, there are some schools of thought that think that that in turn increases the blood flow to your tissues and then allows you to take up more oxygen and then remove more carbon dioxide. So it is as well thought to improve your athletic performance by adding some nasal breathing. It's not saying you have to do it all the time, but it is a useful tool to add in maybe 3 or 4 breaths in through your nose and out through your mouth. And it's a really good technique. It's also a good technique if you're breathless or if you've got a chronic cough, is to try and breathe in through your nose and out through your mouth, because it doesn't cause as much irritation at the back of the throat, especially if you've got a chronic cough. So nasal breathing is really useful.
Excellent.
The second technique is diaphragmatic breathing or breathing control exercises. So we've already said that the main muscle involved in breathing is our diaphragm, this big dome that sits underneath our lungs. But quite often we may have breathing patterns. As we just said, everyone varies. Some people take deep breaths, some have quite shallow breathing. And we need to think about retraining our bodies to use the right muscles effectively. So if people want to have a little go at this technique as well, it's a great technique to support just restoring our normal breathing pattern and getting back in control. It's great for stress reduction and anxiety as well. So in a good, comfortable position. So if you're sat in a chair, make sure you're supported. If you've got arms on the chairs, you can rest your arms on the arms of the chairs as well. But in a good supported position, you're just going to place one hand on the top of your chest and one further down on the top of your abdomen. And you're just going to breathe nicely in through your nose and out through your mouth, not too deep, just nice and gentle. And as you breathe in and out, try and feel whether your hands are moving and which hand is potentially moving more than the other. So
definitely for me, it's the chest.
That one. So that means you're breathing more from the top of your chest, so using some of those accessory muscles as well. So what we want to do is retrain that a little bit, and instead, as you breathe in, you should feel your hand on your abdomen be pushed out, and as you breathe out, that hand should just fall away. This top hand should stay still. So it's not too deep, so just practice a few breaths in and out. If you can't breathe through your nose, don't worry, you can breathe through your mouth, that's absolutely fine, but we're just focusing on the main movement coming from that lower hand whilst the top hand remains still.
So we're trying to almost fill up our tummies, Jane.
Absolutely, but you don't have to force it. It's not about pushing your tummy out, it's just as you breathe in, you should gently feel that hand be pushed away. And as we breathe out, automatically just should fall back and this hand stays still. So that's what we call breathing control. So you can see when you were doing that, you were thinking about the gentleness of the breath in and out. We weren't thinking about deep breathing. We weren't thinking about trying to draw as much air into our bodies as possible. And you also weren't thinking, I feel uncomfortable, I feel anxious. We were thinking gently about the breath. So it's a really good technique to support relaxation and breathing control, which is why it's called breathing control.
Brilliant. So I think with that, and again, this relates to some of the questions that we've had in, you've kind of touched on it, but let's just be clear. Breathing control, so nasal breathing and breathing control, diaphragmatic breathing, breathing control are 2 really useful tips for us, I suppose, to get more efficient and potentially better with our breathing technique. One question which we'll just tee off here is, will this improve my lung capacity if by doing these exercises?
Yeah, so those exercises themselves help to retrain you to use the right muscles and get the air in as efficiently as possible. But a really good technique to help to improve or optimize, should I say, your lung capacity or your ability to get as much air in as possible is a deep breathing exercise. And again, this is really good to support regaining control, and it's a good relaxation technique, but also it does help strengthen your respiratory muscles. So deep breathing exercises, again, in a really good comfortable position. We'll run through one now.
Okay.
Good comfortable position, but instead of putting your hands on your chest and your tummy this time, you're going to put them at the bottom of your rib cage, either side. And as you take a deep breath in through your nose and nice and gently, you'll just feel your hands being pushed away underneath your hands being pushed away by your rib cage. So deep breath in If you want to at the top, you can hold 2, 3, and then sigh the air out gently through your mouth. Now, before I do any more, what I do need to say is that all these exercises can be done very effectively. They can also be done very ineffectively. So I've said to people before, can you take a deep breath in? And they've gone straight away, shoulders up to the ears, neck becomes all tense, and all the air's come in at the top of the chest, but not much has happened at the bottom of the lungs. And what we're aiming to do here is get as much air right down to the bottom of the lungs. So that's why taking that deep breath in a slow, controlled manner is really important. Now, a little visual aid I like to add in here, and bear with me on this one, that can help with this, is imagining you've got a piece of tissue paper stuck to the front of your nose. Okay, so it's around about here at the moment. Now, as you breathe in, that's going to stick to the front of my nose. So I don't want that. So instead, I just want it to be wafting towards my nose. So as I breathe in, it should be a slow, steady breath in. Keep going, keep going, keep going until you can't get any more in. Hold it if you can, 2 and 3, and then sigh it out through your mouth. And this whole time, your shoulders should be relaxed, your neck should be relaxed. All the movement happens at the bottom of your lungs. With deep breathing exercises, my recommendation would be that you do 3 or 4 at any one time. If you feel lightheaded or dizzy at any point, obviously don't proceed with the exercises. Get into a good position and just relax your breathing, return to normal. There are some schools of thought regarding athletic performance on more sets of deep breathing exercises, but that's not something we're going to cover today.
Perfect. Great, Jane. So something for us to think about firstly is nasal breathing. Then we have some breathing control, and then you've just walked us through some deep breathing exercises. Then so we've chatted about in terms of obviously these exercises will improve our performance, make us more efficient, and then in time will help with our breathing techniques. What's the link between potentially these techniques and reducing symptoms of anxiety or feelings in that regard as well, which isn't necessarily something that we're aiming to do by our discussion today, but there's a natural connection between our breathing pattern and how we're feeling in that regard.
No, absolutely. And I think what we're starting to veer into now is what we would term as abnormal breathlessness or dyspnea, feeling breathless. And dyspnea basically describes breathlessness at rest or a disproportionate level of breathlessness on exertion. Now, we should say, obviously, as part of this as well, that in terms of breathlessness, we've already said it's positive, it's a normal response, but it may well be a sign of something more serious. So if you do have shortness of breath at rest and it's lasted longer than a month, or it gets worse when you've been active, if it gets worse when you lie down, you've been coughing for 3 weeks or more, if you've got swollen ankles, or if it's acute, so for example, if it's come on suddenly and unexpectedly, then it is important to get medical advice and make sure it's nothing serious. But sometimes people do experience abnormal breathlessness most days and for a long period of time. And like you say, Andy, there's a number of reasons that might be. How you think and feel about your breathing absolutely can have an impact on your breathlessness, as well as long-term conditions, such as long-term respiratory conditions, such as COPD, asthma, pulmonary fibrosis. There's some heart conditions as well that can cause breathlessness on a regular basis. Interestingly enough, dehydration and problems with kidneys as well. That can cause breathlessness. And as we are now becoming more and more aware, the impact of COVID-19 and the pandemic is now seeing an after effect for an awful lot of people in the form of long COVID. And one of the symptoms quite commonly reported by people who are experiencing long COVID is fatigue and breathlessness. So, like I said, there's a number of things that can cause increased chronic breathlessness, but also that can be impacted, as you've said, by the way we breathe, lifestyle, and also how you think and feel. And we've already touched on the way you breathe and some techniques to work and try and improve the way we breathe. But if we look on how we think and feel and how that can affect your breathing, it is really important. So if you are more worried or more anxious, that can cause you to become more breathless. And it's an interesting thing. So why does it make us more breathless? Now, when we're worried and anxious, we are essentially perceiving some kind of threat, some threat to ourselves, our being. And this goes back to primitive times, whereby if we perceived a threat, our response would be, I'm either going to have to fight something or I'm going to have to run away from it. So our body gets ready to do that, either fight or flight. And that's the response by preparing our bodies to do so. So it'll increase our heart rate, it'll make us breathe harder. So it increases our breathlessness. So if you are anxious and worried, that in itself can make you quite breathless. If you are getting breathless and then you're getting anxious, you're going to get breathless and out of control. That in itself, if that negative thought cycle is going through your head, that can actually increase your breathlessness, and it ends in a very negative cycle. So we need to look at how we can control that and regain control of our breathing, and also keep active within the realms of not becoming so breathless we feel out of control. So again, maintaining that moderate level of activity. So it is really important, and there's a number of sort of techniques and tips you can use to try and support that.
Brilliant, Jane. So, and would we say, for example, what we discussed at the beginning of our discussion today with regards to the talk test, or sort of how this exercise is doing me good? Can I use, if I have, say, for example, exercise-induced asthma, or someone who maybe experienced long COVID, do the same rules apply to how I'm then exerting myself? And I don't know, the one thing that I'm hearing from you is around control of breath. So it's not about pushing it to the point where you're out of control, it's around sort of, so is that, could anyone use that sort of, as I was talking, as a way to gauge how in control they are, be they absolutely asymptomatic with no underlying diagnosis, or be they someone, say, for example, who has, we've just had a question with regards to exercise-induced asthma. Do the same rules apply, or do we need to think about them slightly differently?
Absolutely, absolutely. The same rules apply. It just may well be that your threshold is a little bit lower down, that you're getting more breathless at an earlier point because of other underlying conditions, at which point still you don't want to push yourself past the point whereby you can't speak that full short sentence. But you do want to still get the benefits of being physically active. Now, these breathing exercises themselves, what they don't do is replace any of the medical management plans or treatment plans that you've got in place, or any of the medications you may take in response to managing your condition or any flare-ups of your conditions. Absolutely, you have to follow the guidance of your clinical team. But it may well be that actually breaking down the activity into manageable sections. And this is one of the things we're hearing about from patients potentially with fatigue and long COVID as well, is that the fatigue is very debilitating. And actually that in itself, if they feel good one day, they might really go for it, but then that wipes them out for a couple of days afterwards. It's something we can refer to as bang or bust, that you think, brilliant, I feel great, going to go for it, wiped out for the rest of the week. So it's about slowly increasing activity. As I said, start off with 10 minutes if that's what you can manage. Work at moderate level of intensity, but also pace that activity. And what we mean by pacing is breaking things down into manageable sections. So make sure that you're working at that moderate level of intensity. First of all, you can still speak those short sentences. But if, for example, I had to go from A to B, and I knew that when I got to B, I get to sit down, I get to rest. So I think, right, that's it, I'm just going to go for it. I'm going to get to B, then I can sit down and rest. But actually, I push myself past that moderate level of intensity. I get to B, and it takes me ages to recover, and it makes me scared to do it again because I felt slightly out of control, or maybe very out of control. So that's a negative experience, and we want to avoid that. We want to keep people active, but in control of their breathing at the same time. So instead of going from A to B, hell for leather, right, I'm going to get it done, and then take ages to recover, lower the level of intensity. And if that means we need to break it down into manageable sections, so maybe I'll go halfway from A to B and there's a wall there, I'll have a lean against it. And whilst I'm leaning, I might just do some of that breathing control exercises. So I'm in a nice supported position, I'm getting back in control of my breathing. When I feel back in control and I can speak a full sentence again, then I'll set off. So it's a good little thing to have in the back of your mind to sort of gauge, am I working hard enough to get the benefit, but also, am I working too hard, and do I maybe need to knock it back a step? So it's a good little way, and paced activity is really important day to day if you are chronically breathless.
Absolutely. Easily said, Jane, but I can appreciate, so it requires such discipline. And it kind of relates, if I may refer back to one of our questions that we received in advance, which was, when cycling, I struggle to breathe for about 15 minutes, and then it all settles down and I exercise for ages. Can I stop this? Well, my interpretation of that would be, no, you can't, in terms of, it's not something that you think that you need to stop. it's maybe around that initial ramp up of activity. So you're going from 0 to 80 or 90%, and then that's just your cardiovascular system, your breathing, your circulation needs to catch up. So that's why the first 15 minutes is very difficult. And then everything then is working and in tune and warmed up effectively after that. So I don't know, what would your advice be, Jane, in that case? Because that's a very different type of induced breathlessness for someone who's sounds like they're quite physically fit.
Yeah, and I think you've explained it really well there, actually, in terms of if you go from a sedentary state, as I am now sat here, and then I decide to get on a bike and go, you know, a rate of knots around the field, then I am going to get extremely breathless and my heart rate is going to be pounding because I've gone from one state to an extreme state and my body has to catch up. Now, this is why we often include into exercise and activity a warm up and a cool down period. And it's for good reason. It's not just to stretch off the muscles beforehand, it's actually preparing the body for activity. It's starting to gently increase the heart rate, increase the work of breathing as well. So then we're working at optimal effect when we place that increased demand and go for our main body of activity. Now, there's really good reason why we do that, and I've explained obviously where they're part of it, but also the other thing is it reduces cardiovascular stress. Your heart has got to go from 0 to 60 straight away. Again, you've got to prepare your body for that, start to work up, and the warm up, great, but the cool down is just as important as well. So make sure you factor that in where possible to each of your exercises and activity, because it can actually help to improve your athletic performance over time and reduce the risk of any injury as well.
Absolutely. Jane, what if we are, I think the key point that you raised there is with regards to breathlessness. What we don't want is for the breathlessness to limit anyone or limit anyone's motivation and reduce any fears to actually then becoming physically active. If we can't be physically active, but yet we still want to sort of get into a state of sort of improving our breathing, what can we do? Is there any exercises and things that we could think about other than what we've already covered?
So we've talked about paced activity and well, taking it back as well to what we were saying about the anxieties we may well get about being active and getting breathless. And how do we control that? And we've talked about breathing control being one exercise and positions of ease. They're great exercises if you're feeling breathless and you want to make sure you retain control. Deep breathing exercises as well. My experience is, though, that if you're already breathless and quite short of breath, asking someone to do a deep breath sometimes can be a bit of a step too far and they'll feel more uncomfortable. So instead, there's a few techniques that you can use that can help to shift the focus, if you like, away from I can't breathe, I can't get the air in, I'm feeling tight, I feel uncomfortable. Taking that mindset away and actually thinking, right, let's focus on something else. So we'll do two techniques now, if that's all right. So we'll do some round the box breathing, and we'll do some distraction techniques as well. So box breathing is a really effective technique to help to regain control of your breathing. It's a good relaxation technique as well. Now, although it's called a box, I like to call it rectangular breathing, really, because that works better for me. And quite often we'll be sat looking at something just as now, which may well be a rectangular screen. Exactly. Or you might be in your living room and you've got the TV there, or you'll be in the gym and you'll be able to see the screens there. A rectangle is what you're looking for, or a picture frame. So a rectangular screen, but on the shorter side, so what you're going to do is you're going to breathe in as your gaze goes up one side, breathe out as your gaze goes along the top, breathe in as you go down the other side, and then breathe out as you go along the bottom again. So your breathing will follow your line of sight around the box. Using a rectangle is really useful because you'll use the shorter sides for your breath in and the longer sides for your breath out. The reason being, we want your exhalation to be a little bit longer than your breath in. So if we do that now, we're going to breathe in through the nose as you go up, breathe out along the top, breathe in down the side, breathe out along the bottom. So again, it's not necessarily deep breathing. You can keep going up, and it's just working around the box. So you're thinking about your line of sight, you're following it around, you're thinking about the breath in and out. You're not thinking, I feel uncomfortable, I can't breathe. So it's a really good technique for relaxation to regain control. So that's around the box. The other one that I've used quite a lot with patients who are quite breathless is a distraction technique. because again, quite often the fear is there. I've had this feeling before, I felt out of control, I couldn't control my breathing, I'm heading towards that again. So we need to take that mindset out of the way whilst we look at a good position, some techniques to control their breathing as well, obviously taking any medication that they need to help control their breathing, following management plans. But a simple technique that I used quite a lot with patients is a simple arithmetic. So either doing sums on the heads, or even simpler, counting backwards from 20 in your head, which, believe me, if you are breathless and you're feeling quite anxious, does become quite a challenge. So I don't want people to speak to me, not that I don't want people to speak to me, but I don't want them to say the numbers to me. I just want them to think about the numbers in their head. I've even said to some patients, try and visualize it if you need to. Think about them. What colour's number 4? What colour's number 3? As it's coming in their head. So they're going 20, 19, 18, 17. I asked them to tell me when they get to 0, and it may well be that they've gone from a state of anxiety up here, and I can see them physically start to come down. I have to keep reminding them, don't think about your breathing. Your body will take care of that. We're just getting back in control. We're getting back into your head. So they'll get down to 0, they're still here. Okay, go again. You're looking better, you're feeling better, you're doing well. Good position, go again. But it's a nice little technique that maybe you can do very discreetly as well when you're out and about. You don't need to draw any attention if that's something that worries you as well. So you can find a good, comfortable position, relax your upper body, do your distraction technique. So it's a good little tool to sort of help at that point as well.
Because that's it, Jane. Certainly the experience of breathlessness is not a comfortable one, and it's very much within us. What you're doing here is introducing some techniques that we can take it away from us and almost focus on something else and direct our attention to that. And as you said, key thing you said there is that the body and the breathing will look after itself. It'll self-regulate, it will come down if we can direct our attention somewhere else.
Yeah, absolutely. That plus everything else, like we said, in terms of pacing the activity, not pushing yourself past that comfortable level of breathlessness. And that seems quite an abnormal concept to some people when they go, well, breathlessness isn't comfortable. Okay, well, breathlessness can be comfortable as long as we know we can regain control again. So we need to reset the mindset on that one. Because we've had that negative experience in the past doesn't mean necessarily it's going to happen again in the future. So let's reset and control the level of breathlessness we allow ourselves to get to. But ultimately, if we avoid any activity that gets us breathless, then we become very deconditioned. And deconditioned muscles will lead us to becoming breathless at an earlier point when we do try and become active again. And that's what we call the downward spiral of inactivity. And that in itself can be very limiting in terms of quality of life and detrimental to our overall mental and physical health. So where possible, we try and add these tools, techniques to make sure that people can keep active, they can do their activities that they want to do day to day. From a quality of life point of view, we want people to be able to do what they can do. It just maybe means that they have to modify how they do it. So instead of going from A to B in one go, they'll break up into manageable sections. They still got the task accomplished. They just have to modify how they do it.
Perfect, Jane. So pacing is really, really key, something that we should all be thinking about. In addition to that, if we're feeling like we're getting out of control, techniques such as round the box or round the rectangle breathing, distraction we can use as tools in our back pocket to try and bring us back. But like anything, the more we practice, the more we can be comfortable around that concept of being able to maintain control, which is the key message, really.
Absolutely. And when you're starting to, if it is that you have been breathless or you've had an illness that's meant you've not been as active, we wouldn't expect someone who's never run a marathon before to go out and run a marathon. We would build up slowly. So just as we said right at the beginning, starting off with 10 minutes, using all these techniques, that in itself is an achievement. Trying to do 10 minutes regularly over the week, fantastic. Trying to build that up maybe to 15 minutes, that's your next step. But it's got to be a stepwise approach, and you've got to recognize all the little milestones you achieve. And it is an achievement, especially if you have been deconditioned and you've been chronically breathless or unwell and you're recovering.
Absolutely. Jane, we've had a few questions through, and certainly something that I know was on sort of our agenda today was around sort of chronic cough and breathlessness related to that, or is it chicken and egg in relation to that? I suppose, do you want to give us a little bit more detail around that for those that might be interested? And I suppose maybe any techniques or advice you would have for managing breathlessness related to chronic cough?
Yeah, no, so chronic cough's an interesting one. And obviously there's a number of conditions that can cause a chronic cough. There's also medications that could cause a chronic cough, things like allergies. So there's a number of reasons why we might have a regular sort of irritating cough. And probably the first thing to understand is, you know, excuse sort of the language I'm going to start using here, but first of all, is it a wet cough or is it a dry cough that you have? Because ultimately, if it's a wet cough, it may well be that you've got a condition where you have increased sputum or mucus production, and there are quite a few respiratory conditions that might lead to that being the case. If that is the case, it's really important that you do daily breathing exercises to make sure you get rid of the excess sputum, because that can put you at increased risk of a chest infection if you don't do that. So it's really important to do the daily breathing exercises. Now, sputum is normal. We all have it. We all normally don't even notice it. It's coming and going. We've got these little hairs in our lungs that move it up very effectively, and we might just be swallowed and, you know, it's part of the passing day to day. But like I say, some conditions, there's more sputum than is normal. And if that sits there in lovely, warm, moist lungs, perfect breeding ground for bacteria. So that's why we need to keep on top of that. So there is a technique we can do for removing sputum. And then there's also techniques you can do for a dry cough, an irritable cough, that maybe doesn't have the sputum and it's more, you know, as a result of other methodologies. But if we stick on the wet cough first, if that's all right, we're going to do something called the active cycle of breathing now. Again, obviously, if you at any point during this you feel that you're feeling lightheaded, dizzy, or you know, unwell, just stop the exercise. That's absolutely fine. But it is a really good technique, and it uses some of the techniques we've already used. So it's going to use the breathing control we've already used. It's going to use the deep breathing. But then the other thing it is going to use is a huff. Now, we've talked about a cough so far, and a cough to get rid of phlegm and sputum. Now, the main reason we cough is to actually protect our airway, because we think we've got some kind of threat to our airway. But a cough is a contraction of a lot of structures. But if you imagine, it's like me squeezing a tube of toothpaste. So if I get hold of a tube of toothpaste and I squeeze the middle, that's like a cough. What's above where I've squeezed will come out. The rest will stick down and the tube becomes tight. So you'll have known yourself, if anyone's had a cough over a period of time, or a chest infection, you've coughed and coughed and coughed, you feel tighter and tighter and tighter. You can't get, you know, it's not effective. You've got things further down you can't get out. So that's why coughing's great if you've got stuff right at the top of your airways, but it's not great for getting stuff at the bottom. So using the ACBT, so we'll quickly run through a cycle. I'm conscious of time just now. So in a good position again, nice and relaxed. We'll start off with your breathing control exercise. So again, just breathing in and out, focusing on the air, moving in and out of your lungs, but the main movement coming from where your hand is, so your tummy rising and falling as you breathe in and out, not too deep. So if we're nice and relaxed, now we're going to go on to do 3 deep breaths. If you want, you can keep your hands where they are, or you can move them to the side of your chest. And we're going to do a deep breath in through your nose. Deep breath in. Hold, 2, 3, and sigh out through your mouth. Again, deep breath in. 2, 3, sigh out through your mouth. And then last one, deep breath in. 2, 3, and out. Now go back to your breathing control exercises. Have a cough if you need to, obviously. It's quite useful if you're doing these techniques as well, if you want some tissues beside you, or a little drink of water. So if you do get a cough, you can take a little drink. Just nice, easy breaths, not too deep. Main movement coming again from where your hand is, so your hand rising and falling with each breath. And again, we're going to go through some deep breaths. So if you want to move your hands again, you can, but deep breath in through your nose. Hold, 2, 3, and sigh out. As I said at the beginning, if you can't hold your breath, that's absolutely fine. Just take the deep breath in, sigh out. Deep breath in again. 2, 3, and sigh out. And when you're ready, the last one. Deep breath in. hold, 2, 3, and out. And then again, go back to your breathing control. So what we're doing here is we're alternating through normal, nice, relaxed breathing. We're doing the deep breaths, which is starting to move the air around our lungs, getting it right down to the bottom. So it may well stimulate a little tickle if you've had a bit of something that's there and it's starting to move up. The next thing we're going to do is a huff. So I'll explain it whilst you're doing your breathing control. So what you're going to do is you're going to take a breath in. You're going to imagine you've got a mirror in your hand, and then you're going to open your mouth wide and then huff all that air out as hard as you can. So I'll show you how whilst you're doing your breathing control. So it's a breath in. So it's a short, sharp breath out. Okay. So when you're ready, we're going to have a go. So place your hand in front of your mouth. Breath in. 2, 3, open wide. Lovely. Okay. So that was from sort of a medium to normal breath. We're going to do a huff now from a larger breath, so a deep breath. Again, if you feel lightheaded or dizzy, just avoid these exercises. So breath in. 2, 3, open wide. Lovely. And then if you want to, we can finish off with one, which is just from a small breath in. So small breath, 2, 3, open wide. And you'll feel that get a different area of your lungs. If you feel you've got a bit of phlegm now, absolutely you can have a cough and clear it. But I wouldn't really do any more than 3 or 4 huffs or coughs at a time, because we've done 3 there. We'll go back to the breathing control. Now, if at this point you felt you still had something rattling around, you needed to clear it, you'd go right back to the beginning. So you start off with your breathing control, then do 3 deep breaths, breathing control, 3 deep breaths, breathing control, finish with your huffs. Have a cough if you need to, and that's ACBT.
Brilliant, Jen. The key thing with that is your toothpaste analogy. If we cough and cough and cough, there will always be something left behind. Whereas, again, we're talking about control here, almost bringing it back. Try and use the deep breathing exercises to get almost the air behind whatever that might be there, and then gently persuade it up with the huff, because the huff doesn't close our airways down. It sort of keeps everything open and allows a route out. It's fantastic. We've had a lot of sort of questions through as well, and I suppose just finally, what I'll do, just so as we've got time, I know that you've got a couple of references and a couple of sort of onward points, so just Jamie is in the background for us today. Jamie's going to pop those into the chat for everyone. I don't know, Jane, do you want to just give us a little bit of direction as to those onward sources, should anyone have any sort of further questions with regards to anything you've covered?
Yeah, no, absolutely. So obviously when researching information ahead of this webinar, and some of the references I use regularly anyway, the British Lung Foundation have some fantastic information available for you if you have a chronic respiratory condition, but also if you've had long COVID and you are chronically breathless. So there's a couple of links there that we'll share in the chat, so you can have a little look at those and find information on that. I know that long COVID, when the questions are coming through ahead of the webinar, was one of the topics that rated quite highly. We know there's like 1.3 million people now who the National Office of Statistics suggest are affected by long COVID in the UK at the moment. So it's not an insignificant issue. Now there is an awful lot of information out there, but there's a really good resource called Your COVID Recovery. So we will put that reference into the chat as well. And it's got lots of information on there on managing fatigue, breathlessness, and other symptoms associated with long COVID. So take a look, and hopefully that's been useful.
Brilliant, absolutely brilliant, Jen. I suppose I'm just having a look at the questions that we've got coming through, and I'm seeing there's some questions with regards to exercise-induced asthma. There's some questions in relation to the impact of different chemicals in our bloodstream and breathing patterns. But I suppose if I may sort of just come back, what would be your top tips be in terms of to summarize? Because if I'm correct in thinking, if we can summarize with regards to a couple of sort of the techniques and things, that will then underpin everything, be you breathless from exercise induced so activity, or alternatively currently working with a condition with which may need medical management. So I suppose just to wrap us up, are you able to just quick summary of what you've sort of shared with us today, and what would be your message for anyone leaving us today?
Yeah, so I think obviously we've covered an awful lot today, and it is a very big topic, and we've only touched on some of the elements really. But some of the key things are, getting back to basics, getting the right muscles involved in our breathing, and getting a good normal breathing pattern at rest. So using your breathing control exercises and breathing in through your nose. Making sure you're in a good position to regain control of your breathing, that you're not using muscles which are not normally used in your breathing, you're using the right muscles, and you're giving yourself the best opportunity to either recover from breathlessness or manage your breathing day to day. So positions of ease, breathing control, also using techniques to manage your breathing as well and strengthen your breathing muscles. So the deep breathing, the paced activities, so breaking things up into manageable sections, making sure you're working at a level of intensity if you are being active, which we would encourage, whereby you don't exacerbate any underlying conditions, but you do get the benefit of the exercise by staying within a threshold that you can retain control of your breathlessness using some of those techniques. And then obviously if you do have a cough and sputum production, doing daily exercises to keep on top of that is really important to reduce your risk of further infection. So hopefully that's been useful.
Brilliant. We had quite a task on our hands today. We started off with one idea, and then it just snowballed in terms of other things. So I dare say, Jane, we'll probably have you back, because it seems like a very popular topic, and there's, as you said, we've only scratched the surface today. In terms of any sort of further details with regards to yourself or mhealth and what you do there, have you got any direction or any advice for those that are watching today?
Yeah, so obviously from a mhealth perspective, as I said at the beginning, we do develop apps and support people with long-term conditions. We've got apps available for people who have COPD and asthma, heart disease and diabetes, and they are available through Vitality membership if you are a Vitality member as well, or it may well be something that your local healthcare providers are already utilising, and you can get access that way. So within our apps, we've got advice on how to manage your condition day to day, breathlessness management, different techniques, and also some really good resources that are aligned to mental health and well-being within the apps. So we are going to be sending out information after the webinar, I do believe, about those resources, should it be something you want to access. But they're really good resources, and we're continually developing what our offerings are as well. So yeah, hopefully that's been useful.
Very good. It really has. Thank you so much, Jane. It's fantastic to have you with us today, and thank you so much for the expertise that you've shared. Just for everyone watching, again, thank you so much. Just to confirm, following today's, we have covered a lot today, but you will be able to access this recording within the next 24 to 48 hours via our YouTube channel. So please do take the time to go back, take your time, take those notes, and then also do take the time to follow those links as well and find out a little bit more information. It goes without much further ado to say thank you so much for joining us. After you leave today's webinar, there will be a short feedback form that will pop up. We would really appreciate you taking the time to fill this in. We really do read every single feedback report, and we will do our best to incorporate that as we move forwards to make these events as best I can for you all. Without much further ado, I'll say thank you very much again, Jane. It's been a pleasure working with you today, and thank you everyone for joining us. Have a great afternoon. Bye-bye.
Thank you.
Thank you.